what information would you need, from a community pharmacy, in order to make you say, hey, I want to refer some of my patients to you for a Vivitrol injection?
For alcohol use disorder, are we talking about for alcohol use, opioid, or both?
Both.
Okay. I mean, obviously it's a lot easier for alcohol use disorder. I mean, there's obviously always a chance for there to be opioids, but I kind of cringe almost we do a lot of Vivitrol at our clinic, just with contamination with, stimulants, and if people would have opioids on board, and fentanyl, and, the urine drug screen point of care doesn't test for fentanyl. And kind of having that, worried about withdrawal in a pharmacy situation. I know, because we're looking into kind of, obviously there's issues getting all the clinics to get Vivitrol, and there was some discussion about them also giving it at the infusion center.
Mm-hmm.
And so that's all been put on hold because the monoclonal antibodies and staffing and all that kind of stuff. But that was another discussion point. So I guess that's what my biggest concern would be, at a pharmacy with somebody with opioids and, withdrawal, and how that would be managed and things like that.
Okay.
But I was just going to piggyback on that. If, ideally having a quick way for a pharmacy to contact the clinician if something did go awry, if somebody did go through withdrawal, or somebody came to the pharmacy intoxicated, or, even though it's rare, but, the concerns of suicidality, situations where, it was not the common presentation, and then how, quickly sort of pharmacy would be able to connect with a clinician to ensure that person was going to be safe.
Mm-hmm.
Right. Yeah. And sometimes pharmacy hours are different than clinic hours, and they're open later. Somebody gets an injection at 6:00 and there's an issue. In terms of, the environment at the pharmacy, making sure it's comfortable for patients and, obviously confidential, that type of thing. And that, the pharmacists and staff are, trained around, using destigmatizing language and those types of things. And, in the same way that we try to be in our clinics. And then I guess just, I get alerts that my patients aren't filling their medications at the pharmacy. And, sometimes those are accurate or inaccurate. I'm just wondering, making sure that I know that my patient's actually going for their injections would be the other thing. How is that going to get communicated? Is it going to be with a fax that never shows up on my desk, or?
Other things that I was thinking about were ease and access for patients, how quickly they can get it, how far in advance we would need to order it, what the ordering process would look like, if there's any work through the insurance company, if that's happening on the side of the clinical side or the pharmacy side, just information about that in terms of how they actually mechanically get access and what the timeline looks like.